Hi students, welcome to Case Studies in Healthcare Administration. We are in Unit 3, and for the Unit 3 presentation, I'm going to focus on Case Study 15, and this is dealing with the Federally Qualified Health Centers, also known as FQHC. So first let's talk about what is an FQHC. And according to the Centers for Medicare and Medicaid Services, FQHCs are considered safety nets for providers such as community health centers, public housing centers, outpatient health programs funded by the Indian Health Service, and programs serving immigrants and homeless. The main purpose of the FQHC program is to enhance the provision of primary care services in underserved urban and rural communities. So an FQHC will qualify for enhanced reimbursement for Medicare and Medicaid, as well as other benefits. So FQHCs falls under three different categories. First, they might meet the requirements of the Health Center program and receive a grant under Section 330 of the Public Health Service Act. Secondly, they can meet the requirements of the Health Center program, but does not receive a grant under Section 330 of the Public Health Service Grant. And third, they may qualify as an outpatient health program or facility operated by a tribe or tribal organization. Next, let's take a look at the benefits of being an FQHC. And for FQHCs that are a PHS 330 grant recipients, the biggest benefit is the grant funding. So for newly funded grantees, funding up to $650,000 can be requested. Other benefits underneath this grant include cost-based reimbursement for services provided under Medicare, reimbursement under the Prospective Payment System, which is the PPS, or other state-approved alternative payment methodology for services provided under Medicaid. They can also be eligible for medical malpractice coverage, also eligibility to purchase prescription and non-prescription medications for outpatients at a reduced cost. They have access to the National Health Service Corps and access to the Vaccine for Children program. And then the other benefit is eligibility for various other federal grants and programs. So next, let's talk about the Section 330 Public Health Service Act Health Center Program. And this is the grant that we talked about that FQHCs might receive. And so under this act, it defines that the Federally Health Center Program has the funding opportunity for organizations to provide care to underserved populations. And these grant programs include New Access Point grants that provide funding to support new service delivery sites that will provide comprehensive primary health care and access to oral and mental health services. Also, expansion on the medical capacity grants that provide funding to expand access to primary health services in the health center's current service area. Another area is service expansion grants, providing funding to add new or expand existing mental health or substance abuse, rural health, pharmacy, and enabling services for special populations in the existing health center. And then finally, you have the service area competition grants, and they provide ongoing continuation funding for service areas currently served by health center grantees. So there are different types of health services that are provided by a health center. So health centers must provide primary care services for all age groups. Health centers must provide preventative health services on-site or by arrangement with another provider. Other requirements that must be provided by a health center or an arrangement with another provider include dental services, mental health and substance abuse services, transportation services, as well as hospital and specialty care. So how does someone get certified as an FQHC? So health centers, migrant health centers, healthcare for the homeless programs, and public housing primary care programs that receive a grant funding under Section 330 of the PHSA. They're automatically certified as an FQHC. And then finally, how does an organization apply for the Section 330 PHSA Act Health Center Program Grant? And the first step is to make sure that the location or population served is eligible and that you have community support. So health centers must serve a medically underserved area or population, and the community needs to be in support of an FQHC.